Welcome to the first Learn Now video of the Maternity Management Practices video series. This video describes important information regarding the physiology of parturition in dairy cattle, needed to better understand the whys behind the calving management practices in maternity operations. The parturition process is a continuous event divided into 3 stages that occur sequentially, gradually progressing from one to the next. The stages are Stage 1, Dilation, Stage 2, Labor, and Stage 3, Expulsion of the placenta. There are specific signs that occur in each stage, which are critical to determine if and when the cow might require assistance delivering its calf. During Stage 1, the soft tissues of the birth canal, such as the pelvic ligaments, the cervix, the vagina, and the vulva, dilate and expand to allow for passage of the calf. The calf also adopts the proper position for delivery, and the uterus begins contracting. These processes move the fetus through the birth canal. During Stage 1, there are specific signs known as imminent signs of parturition that are used to identify the proximity of the second stage of parturition. The onset of the appearance of these signs can range from several hours to only 45 minutes prior to labor. The most common imminent signs of parturition observed in dairy cows are cows looking towards their abdomen, enlargement of the udder and leaking milk, fluid discharge from the vulva, swelling of the vulva, increased frequency and duration of tail raising, and ground leaking, among others. In this video, the cow is looking at its flank, licking the floor, its tail is raised, its vulva is swollen, and its udder is enlarged. This particular cow started labor 10 minutes after this video was taken. Stage 2, better known as labor, is the active phase of parturition, characterized by the start of abdominal contraction and the total expulsion of the fetus. There are 2 calf presentations that are considered normal in cattle, which are extended forward and extended backward presentations. In the forward presentation, the first structures to appear through the vulva are the front legs with the head of the calf positioned on top. This is the most common presentation in normal calvings, occurring in 96% of the cases. On the other hand, the backward presentation is less common, occurring in 4% of the cases, where the 2 rear legs of the calf appear first through the vulva. Regardless, the appearance of either the water bag or the feet of the calf through the vulva are considered to be time zero of the second stage of parturition. A normal parturition process is a spontaneous process that gradually progresses from the appearance of the abdominal contractions to the appearance of the water bag or the feet of the calf through the vulva, then the calf's nose, and so on, until the calf is totally expelled. Progress during a normal calving should be observed every 15 to 20 minutes. The whole process, from time zero to the total expulsion of the calf, normally lasts between 40 and 45 minutes, with a range of 30 minutes to 4 hours, often being longer in heifers. On the other hand, an abnormal calving is known as dystocia. This is characterized by a prolonged duration of labor and/or an assisted extraction of the calf. Dystocia is a prevalent event on dairy farms, ranging from 14% of calvings in mature cows to 23% in first lactation cows, and causes significant economic losses. Common causes of dystocia include mismatch of fetal-maternal size, abnormal fetal position, uterine inertia, and uterine torsion, among others. For more information regarding identification and assistance of difficult calvings, please watch the next 2 videos of the Maternity Management Practices Learn Now video series. The final stage of parturition is expulsion of the placenta. Normally, the placenta is expelled within 24 hours after parturition. Failure to expel the placenta within 24 hours after calving is known as retained placenta. The incidence of retained placenta in dairy farms can range from 5% to 15% of calvings, and it is an important risk factor for eugenic diseases and low reproductive performance. Thank you for watching, and for more information regarding recognizing and monitoring dystocia, watch the next video of the Maternity Management Practices Learn Now video series.